Mr. President, I'm here with my fellow freshman senators because we're united in our determination to pass health insurance reform this year. Our late and giant colleague, Senator Ted Kennedy, said it best when he called health reform the great unfinished business of our society. And we're presented, Mr. President, this fall with a historic opportunity to finally succeed, and for me, failure is not an option. The cost of inaction is too great, both for American families and for our economy. We have a bloated $12 trillion federal debt, which is being fed every day by growing health care costs. Every day, small and large businesses are laying off workers and slashing benefits to their employees. And those Americans who have coverage still do not have the peace of mind that comes from knowing that companies, the insurance companies, will keep their promises. Premiums are rising at 3 times the rate of wages. The number of uninsured is growing at a faster rate every day. In my home state of Colorado, nearly 1 in 4 are uninsured in some areas. And the Treasury Department recently released a study showing that 1 out of every 2 Americans will lose coverage at some point over the next 10 years. Mr. President, we can't allow this to become America's future, but it will be if we don't act now. Now, there are many reasons that health reform can't wait, but there's one that I know strikes a chord with many Coloradans, and that's the lack of freedom that our current system provides. Workers across our company are afraid to leave their jobs for fear that they won't be able to provide health care to their families. And that lack of freedom affects our economy because fostering the growth of small business is one of the keys to economic success. But in our current system, Americans are afraid to follow their dreams and start a small business or travel to go to work for a new company. Small businesses run on thinner margins than their big company counterparts, and they're being hit hardest by the rise in health care costs. For example, in my home state of Colorado, we have a disproportionate share of small businesses. And as a result, we have more citizens who are uninsured. And those that do offer benefits are finding themselves increasingly facing no-win decisions. They are faced with either hiring fewer employees or slashing benefits or dropping coverage completely or in some cases going out of business forever. The proposals in front of us are tailor-made to help small businesses. The ideas in place would provide tax credits and create a simplified, well-regulated, pooled marketplace to help small businesses find cheaper and higher quality coverage. It's estimated that reform will save small businesses more than $500 billion over 10 years, or more than $3,500 per worker. And that's real money, Mr. President, that can be reinvested in business growth and adding additional jobs to fuel our economic recovery. Now, the burden on individuals is only one of the culprits preventing economic growth. Our deepening federal deficits and long-term fiscal outlook are also closely linked to the broken system. As President Obama said in his address to Congress just 2 weeks ago, our nation's health care problem is our deficit problem. Just think, we spend $2 trillion on health care per year. Mr. President, that's more than 1 out of every $5 spent in our economy, more than twice what any other industrialized nation spends. And I think we would all agree we're certainly not twice as healthy for our money. And if this number continues to grow, there's no hope for reining in the long-term deficits that we face. Health insurance reform is the golden opportunity to begin to control our deficit. We can and we need to grab this opportunity and make health care the springboard from which we clean up our long-term fiscal mess. The President reminded us that the growth of health care costs, if we slowed that growth by 0.1% a year, it would help bring down the deficit by $4 trillion. There are many excellent ideas on the table to help us get there by ensuring Medicare's solvency, reforming Medicare's payment structure to bring down cost growth in the long term, and discouraging over-generous health plans that cause overutilization of our system. Now, Mr. President, as Senator Warner and others have pointed out, many of the proposals being discussed are politically difficult to support. But not facing politically difficult decisions head-on is what's caused so much of the inertia that's brought us to where we are today. We don't all agree on exactly the best way forward, Mr. President, but I think we do agree that it's time for every member of Congress and every member of the Senate to think about health insurance reform for what it is. A huge and necessary step to putting our economy back on track and finally providing stability, security, and freedom to the people of our country. If we do this, I know we can find common ground, and we must, because the cost of inaction is too great. Mr. President, I yield the floor.